Hi, and for this week we're going to be focusing on treating our SCM, so our sternocleidomastoid. And that's a muscle that runs from just below our ear, and it comes quite anterior, quite forward, and it attaches at our collarbone here, and it then goes on to join, or onto the sternum as well. But the area that we're interested in treating is from under the ear here, forwards to the collarbone area. So I'll just show you a quick picture so you can have an idea of where they are. So we've got one each side. So here's the muscle here. It attaches below the ear. It's something called the mastoid process, and it comes all the way forwards and attaches here on the clavicle. And as you can see, it also goes on to attach here to the sternum, but we're not actually really able to get into those fibres, and they're generally not so relevant for us anyway. And we've got one each side. So the first thing we're going to do is just get an idea of where it is. So you take your head to the right, so your right ear towards your right shoulder, and just drop forward a little bit, and then just have a go at palpating around this area. What you'll find is that you have something there that you might not have actually realised was a muscle, because it can feel quite hard and quite ropey. So just get some pincers and just have a go at seeing what you can pick up there. And you can also see it if I turn my head to the side, you can feel it pop out there as well as it stretches. Okay, so first of all, we're going to do a move on this, which I like to call raking. So we can do both sides at once. So we're going to get our fingers, and we're going to start around here. So you should be able to locate your collarbone there. And then it doesn't matter so much about location here, we're just in the general area, which is really enough. And we're just going to come up with our fingers. So we get to just below the ear, and you can feel the bone there, the mastoid process. And then we're just going to repeat that a few times. So we're just kind of doing something that feels quite nice, and we're saying to that muscle, oh, by the way, I'm going to be in there soon. So we'll just repeat that 3 or 4 times or so. If your skin starts to look a bit red like mine, then it's nothing to worry about. And now we're going to have a go at treating. So if you take your right ear towards your shoulder, like we did just now, and just drop your chin slightly so you're in this sort of position. I'm going to turn around a little bit so you can see me better. Then we're going to get a pincer grip, so our index finger and our thumb, and we're going to come to just below the ear, and you should be able to pick up, and it feels a bit like a tube-like structure. So you can even think about sort of getting underneath it if that's not too sore. So you're picking it up and you're giving it a squeeze and seeing how that feels. And this is trigger point work similar to what we've done on the traps before. So if it's sore, we're going to hold there for 10 to 12 seconds. If not, we're going to move down a little bit. Give that a squeeze. See how that feels. Is there any soreness? Is there any pain or any sensation going into our face, temple, teeth, jaw, nose, ear? If it all feels fine, we'll move on. If it doesn't, we'll hang out there for a bit longer, 12 seconds or so. Now, as you get a bit lower, you might find you want to use, rather than this movement, it might be more this sort of movement. So you've got your finger, the top of your finger laid flat there. Then you get your thumb and sort of push the muscle towards it. If it's easier for you to just carry on with that pincer movement, then do that. You're going to see how that feels. Is there any trigger points there? Carry on, and then you'll find that you get really close to your collarbone. It's quite a little bit tricky to pick up, but if it's loose enough, you might get another one there, just at that attachment point. And again, holding that for 12 seconds if it feels sore. And then we're going to repeat that. So going up, remember if you turn, it's a funny muscle this, because if you turn towards it, then with, if you put your ear towards it and then drop your chin, then you're actually helping it to contract slightly, and then you can pick it up easier. So the automatic thing is sort of to feel like you have to go away from it to be able to pick it up, but you actually need to go further into it, and it gets a bit easier to locate. Again, seeing how that feels, moving down. Seeing how that feels, moving down. Holding each point for 10 to 12 seconds if there's any pain or phenomena anywhere else in the head. And when you've got back down to your collarbone and you've treated each trigger point twice, then we're going to move on to the other side. So you can rest the elbow on a desk or a table here just to save your arm a little bit. So we're going to get that pincer grip. We're going to take our left ear towards our left shoulder a bit, rotate the chin towards the shoulder, and then look for that to pick up that tube-like muscle there. Seeing how that feels. Holding it for 10 to 12 seconds if you need to. If there's any pain or feeling or sensation anywhere else. And then coming down and repeating further down. Coming down a centimetre or so. Repeating that, seeing how that's feeling. And you might get one or two more there as we approach the collarbone. Just take the time, pause the video if you need to, if you need a bit more time to get the 10 to 12 seconds. If you've got a lot of spots there, you might need to pause while you go over each one of them for 12 seconds. And then repeat again. So really grasping that structure there. Seeing how that feels. And coming down. And coming down again. And then once more. Okay, then we're going to do something a bit nicer again. So we're going to repeat that raking. So we're going to start at the collarbone with our fingers, and now you've got a bit of a better idea of where muscle sits as well. So we're just going to slowly draw our fingers up towards the ear. And just applying a bit of pressure, like sinking in a little bit with your fingers so that you're actually feel like you're making contact with the muscle itself rather than just the skin. And we'll do that 3 or 4 times. Okay, then the last part of this routine is stretching that muscle. So we're just going to start with what's known as a passive or a static stretch. So we put the muscle on a stretch and then we wait there for 30 seconds. So what we're going to do is, first of all, we're going to stretch the right side. So you're going to take your left hand, sorry, you're going to take your right hand and put it on your left cheek. And then you're going to bring the head around in this rotational movement. Keep both the shoulders dropped. And it can be quite difficult to achieve, but what we're looking for, I'm going to come out of the stretch now to talk you through it, but you continue in the stretch there. And what we're looking for is a feeling of a stretch on the right hand side. So it's actually the side that you're turning into that we're looking for the stretch. You may not be able to get it at first. You might, particularly if you're particularly tight on the other side, you might be feeling it more there. But that is the aim. Just remembering to keep your shoulders dropped and your spine nice and tall. I'm just applying a bit of pressure with that hand to maintain the stretch. Okay, then coming back to center. Then we're going to repeat that on the other side. So your left hand is coming to the right cheek. And then you're drawing the cheek around till you can feel the stretch on the left hand side. So it's a stretch in your neck area that we're looking for on the left. Just maintaining that pressure with the hand. Just for a little bit longer, keeping the shoulders dropped and keeping the spine tall. And remembering to breathe. And come back to center. Okay, so just to recap there, we've got the raking move. We've got the trigger point work, repeating that twice on each side and holding any trigger points for 10 to 12 seconds. Repeating the raking on both sides. And then we've got the stretch, which looks like this. And you may notice some funny sensations with this muscle, so just let me know how it feels. It's quite common to have sort of feelings in the eye or the ear or the nose or the throat or anywhere on the face. So if you get that when you're treating one of the points, then that's a particularly interesting trigger point to go back to. So just make sure when we're doing the second wave on each muscle that you try and actually locate that point that was causing that phenomena. Okay, let me know how you get on.